And the U.S. starting to see a sizable amount of reinfections. So joining us to talk more about this is our chief health editor, Dr. Partha Nandi. Dr. Nandi, good afternoon. How many times can a person get infected with the virus?
Yeah, unfortunately, Glenda, there are folks who are catching the coronavirus more than once. I'm sure you've heard of people, and many of my patients have. And I've actually heard of some folks getting reinfected third or fourth time. Now, not so long ago, right? We thought reinfection, that was going to be rare, but that was before Omicron. The virus has since evolved and now it is very, very effective in reinfecting people. People who actually were initially infected with the first Omicron variant can now get reinfected with its newer variants. And we talked about BA2 or BA2121. Now you may be wondering, why would an infection with Omicron not provide enough protection against one of its descendants? Well, the science tells us that even though Omicron's variants have few changes to its genetic code, there are still enough differences. And two studies suggest that this new variant, BA2121, Linda, may be even better at avoiding prior immunity than previous Omicron subvariants. On top of that, the Omicron infection does not produce a very strong immune response. So the protection decreases quickly, which opens the door for another infection and maybe 3 or 4 months later.
So how are our vaccines holding up against this reinfection? Like if a person avoided long COVID with one infection, could they still develop long COVID after a second or third infection?
So short answer is I think they're doing well. Now, if a person has had the vaccine, right? They can still be breakthrough infections, but preliminary research suggests that BA2121 has escaped mutations that make it a bit more resistant to our vaccines. So it's causing a few reinfections, even those who are vaccinated. But here's the important point that we've said before: our vaccines are still effective at preventing serious illness and death. That's key. As for long COVID, it's possible a person can have symptoms for weeks or months after any infection, but there's not enough data, Glenda, yet to tell us what might happen in folks who are vaccinated. We got to remember that this coronavirus is kind of like a forest fire. It's always looking for some wood to burn or some place to burn. And vaccination can help lower the risk of infection and help people from getting sick so that they're not hospitalized, and also prevents death. If a person, however, again, this is important to hear, if you have a weakened immune system, if you're older or have underlying health conditions, they should also reduce the risk of infection by doing this: wearing an N95 mask while indoors in public places, avoid large crowds, and stay up to date. And this last point is important: stay up to date with vaccines and boosters. Many of my patients who are at risk are still not boosting. And that's disappointing to me because that's the protection you have that you can control.
Yeah, we're still learning as we go. Thank you so much,
Absolutely.
Dr. Nandi. Appreciate your time.
My pleasure. Thank you.